Stainless steel crown preparation of tooth 8-5. Step 1. Occlusal reduction. Using a wheel diamond in a high-speed handpiece, a 1 to 1.5 mm flat plane reduction is completed by starting at the depth of the central groove and carried outward along all cusps. Reduce one cusp at a time to ensure equal reduction of the occlusal surface without loss of a reference point. Starting the preparation with occlusal reduction will allow for better visualization and easier access for caries removal. At completion of the occlusal reduction, verify that the preparation does not slope mesiodistally or buccolingually. This can be done with both a mirror placed on the lingual and buccal sides and with direct vision. Step 2. Caries removal. A 557 burr is used to establish access for caries removal. The burr is not used to excavate caries to the depth of the lesion, but used to create access for a round burr in a slow-speed handpiece or a spoon excavator. A spoon excavator is used to remove gross caries. A large round burr, such as a number 6, is used to further remove the caries. The spoon excavator is then used gently to remove all remaining caries. At this point, the tooth is thoroughly cleansed and dried. An explorer is used to check for pulp exposure. This is a critical step, as an exposed pulp in a primary tooth may not bleed overtly. If a pulp exposure does occur, a pulpotomy procedure is completed at this time. Step 3. Proximal reduction. At this point, a pair of scissors is used to cut the dam interproximally. Using a tapered diamond burr, the proximal reductions are completed. The proximal reduction is knife-edged and carried subgingivally. The burr is carried from buccal to lingual or vice versa in one continuous movement. This method avoids creation of ledges. Step 4. Round all line angles. The tapered diamond is used to round the interface between the occlusal, buccal, lingual, mesial, and distal surfaces. Failure to complete this step may result in frustration while trying to seat a crown that is getting caught on a sharp interface. If the tooth that is being prepared is also the tooth that is clamped, it may be necessary to refine the preparation after the rubber dam is removed. If this is not the case, the rubber dam can be left on until the time of cementation. Step 5. Selection and adaptation of the crown. The crown is selected to fit the mesiodistal width of the tooth. In this situation, an ion crown is being fitted. The crown is always seated from the lingual to the buccal. An explorer is used to check the fit of the crown. A cleoid-discoid is a useful aid in removing the crown. Place a finger on the occlusal surface while removing to avoid loss of control of the crown. After crimping, the crown is tried on again, and an audible click is heard as the crown seats. Step 6. Crown cementation. Prior to cementation, the crown is thoroughly cleaned and dried. A suction tip is placed near the gingival crevice and can keep blood from seeping onto the crown of the tooth. The crown is completely filled with a glass ionomer cement. It is placed on the lingual and seated toward the buccal. Excess cement is expressed as the crown is seated. A moist gauze can be used to remove the bulk of the excess cement. The remainder of the cement is washed away with an air-water syringe. A band seater or bite stick is then used to ensure the crown is completely seated. The child may also bite down using the opposing dentition to seat the crown.